You know, the Supreme Court of the United States upheld all but one component of President Barack Obama's health care law today, and tonight we know what this ruling means to you. Now listen closely here. Beginning in the year 2014, virtually all Americans, including those here in the Mid-South, will have to get health insurance or pay a penalty. There will be help for people to get coverage thanks to state-based marketplaces and federal subsidies to help low-income people buy insurance plans. The law will also expand the eligibility rules for Medicaid, but it will be up to each state how to deal with the expansion. Tonight, folks living in the Mid-South are reacting to the new health care law. Action News 5's Jamel Major joins us live in the studio with the story. Jamel?
Joe, the Supreme Court's decision has definitely gotten the attention of doctors across the Mid-South. I spoke with one of them who says it'll be interesting to see how the court's decision will affect the way people receive and pay for their personal care.
What most people don't understand is that in reality, nothing happened today. What the Supreme Court did was to affirm what has been the law of the land for the last 2 years.
For years, the Church Health Center in Memphis has been providing quality, affordable health care for low-wage and working uninsured. Now, Executive Director Dr. Scott Morris is reacting to the Supreme Court's decision to uphold the heart of President Obama's health care overhaul by ruling in favor of the requirement that most Americans can be required to have health insurance or else pay a penalty. But Dr. Morris says there are still a lot of unknowns.
How does this law ultimately get applied? The challenge will be defining the law. It's 2,500 pages. In order to implement the law, it requires writing what are known as regulations.
Meanwhile, the court also has found problems with the law's expansion of Medicaid. It said the expansion could proceed as long as the federal government does not threaten to withhold the entire Medicaid allotment to the states if they don't take part in the extension.
The federal government will give states money to expand the program. But after the first few years, states will be on their own. The state of Tennessee struggles with paying its current bill for Medicaid. That's a very big unknown.
And Dr. Morris says there's still a long way to go because the law may not be fully implemented until 2019. Live in the studio, Jamel Major, Action News 5.